Myocardial infarction is a severe and very common health syndrome. Approximately 3 million people worldwide have a so-called STEMI myocardial infarction, and approximately 4 million people so-called NSTEMI. These are different types of myocardial infarction. So you can see this is very widespread all over the world. And myocardial infarction is associated with a certain lifestyle that's spreading through industrial countries, which is associated with too much food, especially too much unhealthy food and not enough exercise. And this leads to overweight and obesity and the so-called metabolic syndrome, which is a collection of health problems, including cardiac problems and problems of the blood vessels. Metabolic syndrome can derive by different ways. It's not totally clear what is the causative factor. One of the organs that may contribute to metabolic syndrome is the liver. The liver has been regarded as a bystander organ for a long time, which is affected in metabolic syndrome by non-alcoholic fatty liver disease. But the liver is a very important metabolic organ that metabolizes proteins, fatty acids, carbohydrates, and it produces coagulation factors and other proteins and components that are important for the blood vessels, and also for the function of muscles. So we analyzed the association of classic liver parameters. There are certain factors that you can measure in blood and see how much the liver is damaged. And we're looking for associations with myocardial infarction, especially with repeat myocardial infarction. So people who already had one have a certain risk of having another one, which you actually would like to avoid. And we found that liver parameters were associated with repeat myocardial infarction, or the risk of repeat myocardial infarction. The diagnosis to find this out usually involves an intracardiac catheter, which is an invasive method and is not without danger for the patients. And it's also not very nice to have an intracardiac catheter. So what we like to have are easily measurable blood parameters that tell us how high is the risk for someone who already had myocardial infarction to have another one without the need to perform an intracardiac catheter, especially for people who have a not very high risk, because those would receive this method in vain.
As we already heard, cardiovascular diseases are the main cause of death in industrial and developing countries. However, many cases of heart diseases could be foreseen by monitoring blood parameters of the patient, thus reducing the risk of death and the need for treatment. Extensive research in the recent years enables us to develop a personal healthcare device that can predict upcoming heart diseases by measuring changes in specific parameters in the blood. The measured data is then transferred via Bluetooth to your smartphone, and in combination with our new smartphone app, the need for treatment is predicted by using sophisticated computational models from the field of machine learning and statistical learning. Our solution is easy to use and gives you the chance to monitor changes in the blood yourself without waiting at the doctor's office too long. If you wish, the data is sent, encrypted of course, to your doctor via a secure channel. Due to the separation of measurement in the medical device and the logic in the smartphone app, new computational models can be easily integrated into the system, for instance for predicting hepatocellular carcinoma or other types of cancer.